Good evening, everyone, and thank you very much for joining us on this evening. Another conversation, We Can Do This, Indian Country, the state of the COVID-19 pandemic in Native communities from Alaska down to the lower 48, California to Maine to Florida. I'm David Knoyer, and I'm pleased and honored to be the moderator of what we hope is an interactive discussion. I'm a member of the Rosebud Sioux tribe, and certainly the pandemic has hit my relatives there and fellow citizens of the Rosebud Sioux Nation. It just isn't going to stop, folks. We have read the headlines about the Omicron variant, which is spreading as fast in the last week as the original coronavirus did in the first month, right? 1 of every 5 infections is an American child. So it's touching different parts of our communities, and it's spreading faster than the Delta variant did. And so this discussion tonight is to talk about the current state of the pandemic in ideally specifically the Pacific Northwest, but across all of Indian Country. And this is part of the We Can Do This campaign, sponsored by the U.S. Department of Health and Human Services, along with a number of partners, including the Indian Health Service and local tribal leaders organizations such as the Rocky Mountain Tribal Leaders Association. But tonight we're going to hear from two speakers from the Pacific Northwest. And before we get to them, I want to play a little clip from the We Can Do This Indian Country campaign. The subcontractor for the campaign is G&G Advertising, which is a Native American firm based in the greater Portland area and Billings, Montana. And G&G has produced a number of American Indian Alaska Native specific messages. And I want to play this 30-second video that has to do with now the Pfizer vaccine, right, being receiving emergency authorization for Native children ages 5 and older. So let's watch this 30-second clip from the We Can Do This campaign.
Do you know I love you so, and mommy will never let you go. To the stars and the sky, you'll always be mommy's little guy. Hey oh, hey oh, hey oh.
Very nice. You'll always be mommy's little guy. We are seeing more and more, right, that this is now a pandemic of the unvaccinated, and so many of the hospitalizations and illnesses are affecting unvaccinated folks. And so the best protection against this Omicron variant, right, is to get vaccinated. And to talk about that, we're not telling you to do it. We want you to find the best resources and hear from other people who've been through it. I received the Moderna vaccine in April and May of last year and received the booster shot a couple months ago. 5 or 6 months later is what they're recommending, right? So 5 months after your second shot, go get a booster. So it's really a 3-shot regimen, right? And if it's the Johnson & Johnson vaccine, 2 months after that 1-shot regimen of Johnson & Johnson. I would like our folks, Native Roots Radio is our media partner, working with G&G Advertising on this. And if we could bring in our first guest, Luhui Whitehear, that would be awesome. I know we have some technical issues going on with our other guest tonight, but Dr. Luhui Whitehear, you're running the Native American Center at Oregon State University. Thank you so much for joining us tonight, and let me have you introduce yourself.
Haka everyone, my name is Luhui Whitehear. I use she, her pronouns. I'm enrolled with the Coastal Band of the Chumash Nation, and I also have Cochimi and Aztec ancestry. You may hear my small child in the background because I can hear her. And I'm an assistant professor for the School of Language, Culture, and Society at Oregon State University, and I also serve as the center director of the Kagawix Mana Ina House, which is our Indigenous-based center on campus. And thanks for having me.
Well, thanks for joining. And you mentioned your young child there. Is your child old enough to receive the Pfizer vaccine, which is for children age 5 and older, or not quite yet?
Yeah, I have several children, and they all are eligible, and looking forward to the booster rollout too for their age groups once they're ready.
What's the pandemic been like there at home for you, Dr. Whitehear?
It's been a little bit all over the place. I think the hardest part is not being able to see my parents as much as I would like to. Last year, I was really excited to get the Moderna vaccination so I can potentially go see my father in California. And unfortunately, he unexpectedly passed away before I got the second one. And so that was really hard in not being able to do like a large celebration for him, and just being able to do something really small with my brothers and everybody to help him transition ceremonial with our ways in California, but to not be able to gather the people together like we would like to was really hard until much later. And we were able to do that over the summer in that really small window that we had before Delta hit. And so it's been hard, but then I have my parents up here, my stepdad and my mom, and just want to make sure like I work with a lot of people on campus and just wanting to do my best to stay as healthy as I can so the kids can see their grandparents here in Oregon. They live over in the Sluts area off the Sluts River, um, and so I think that's been the hardest part is not being able to see parents and also to do the ceremonies in the ways that we're used to, and having to change that up a little bit.
Yeah, absolutely. Well, condolences to you with your father. I know it was a difficult year for a lot of folks whose people passed due to COVID or for other reasons, right? And still really haven't had a chance in some instances, right, to really say goodbye and to have the community around you. There's nothing worse than doing that alone, right?
Yeah, yeah, it's hard.
Let
Yeah.
me stay with us, Dr. Whitebear, and let's bring in our other guest tonight, Dr. Dakotah Lane, a medical doctor at the Lummi Nation Health Clinic, way up I-5 from you, Dr. Whitebear, toward the Canadian border. Dr. Lane, thanks so much for joining us and taking time out from your family tonight too. I know you have some fairly young children yourself. What's the state of COVID-19 there in Lummi, Dr. Lane? You're still muted, sir. There you go.
All right, let's try this again. Can you hear me?
Yes.
All right. I'm sorry. I've been clearly having issues with technical issues. I was on with my phone, but the sound was really weird, and
It's all good.
switched computers. So back to Lummi and COVID. All I can say is that Omicron is everywhere. I think everybody probably was affected by it throughout Christmas and New Year's. And there's no doubt that Christmas and New Year's was a super spreader event. And now we're seeing the rising in case and numbers. Lummi reached its highest ever peak of cases to 195 cases at one point. Right now it's at 162 as of this morning. This weekend we got another 40 cases, and it's Omicron is just highly contagious. On my mom's side, my parents are divorced, so on my mom's side, their whole household got it. On my dad's side, then the Lane family, we canceled our Lane gathering because everybody got it. And I ended up, I'm sure like many of you, stuck with your family. I have 3 kids and a lovely wife, and the 5 of us spent Christmas and New Year's together, but not without any of our extended family because everybody was positive.
Wow. And you're super busy at work too, I'm sure.
Yeah. Yes, to say the least. We're juggling for a while at the beginning of this month. Normally, I'm a little bit more comfortable because I actually have treatments like monoclonal antibodies. Since the beginning of the pandemic, we've done over 50 monoclonal antibodies. It's the same treatment that Donald Trump got, our President Trump, back when he got it. And that was being offered to a lot of our community members. Unfortunately, Omicron made that treatment just useless. So we had to wait for another treatment, which we got on Friday, yesterday. Wait, what's today? Sunday? 2 days ago. And we started using that treatment on Friday. Also, we just got a new shipment of the new Pfizer. It's called Paxlovid, the oral medication treatment. However, I was hoping it was pretty easy to prescribe, but it turns out it actually has a lot of interactions, and we have to be careful with how we have to take a full history of the medications they're taking, including any over-the-counter medications. any for example, we were about ready to prescribe one to a patient that has severe asthma, but it turns out that it interacts close with the asthma medication, and so we weren't able to prescribe it. So it's really been a complicated way to provide treatment to a lot of our community members.
Mm. Are you then seeing, you said, Dr. Lane, that Omicron is everywhere. Are you Do you have a sense that the symptoms and the sickness is less than it was with Delta, or is it too early to say?
Well, I will say from the beginning, it's really odd. And I say that because we got this wonderful tool called the rapid test antigens. Probably many of you have used it and tried it. And you have symptoms like runny nose, sinus congestion, maybe a sore throat. And you test it and it's negative. And then a day or two later, you follow up with another rapid test and it's positive. And we noticed a rather interesting phenomena for those who are fully vaccinated or boosted. That seems to happen more often. So if you have those symptoms, we are telling our community to continue to isolate and take precautions, social distance precautions, so you don't expose others. And we also have noticed that it does appear to be less severe. That's true. But I think what's happening, like right now, we have two tribal members who are hospitalized, and we're trying to figure out. The issue is we can't quite fully tell if it's Omicron or Delta. And so Delta is probably more deadlier. Omicron is also seems to be less deadlier, but I will say it's probably too early to tell. We'll know by the end of this coming week, and to know if it's deadly. I just don't have a good answer for you. Um, and the good news is that particularly in Indian country, the majority of our elders, at least at Lummi and from the national data I've seen, majority of our elders are vaccinated and boosted even. And so they seem to be well protected. With Omicron, for those who are boosted, are recovering. Like it literally is like a day of sinus congestion, and you know what? Maybe did I have it? And so that seems to be happening. And so it's really a mixed bag, and we hope that it flames out without much deadly consequences. And so I would actually argue that the biggest risks, particularly at Lummi and probably in Washington State, because the majority, only know the tribes around Washington State, but the majority of the tribes are pretty well vaccinated. The biggest risk is actually the hospitals. In Washington State, we have this really mixed bag of really heavily Democratic areas and really heavily Republican areas. And this is borne out in national data. So Republicans tend to not be vaccinated, and those are the ones that end up being hospitalized. And so what that does is right now our hospitals have been running at 103, 105% with 45 COVID cases. I can only speak for here locally. What that means is that those who are looking for, say you have a heart attack, stroke, thank you, sweetheart. Heart attack or stroke. This is my daughter. Sorry, she just is excited. If they go to the hospital, they might get substandard care, and that's not because the staff are just bad. It's just because they're overwhelmed. So I know here at Lummi we've been advertising or advocating. Sorry, not advertising. Advocating the governor to consider using the National Guard to help provide support to the hospitals and also to nursing facilities so that they may relieve some of the beds that are full there and open up more beds. That's what's happening here locally. And from what I read nationally, it's probably happening nationally as well.
Hmm. How about there in your clinic? is your staffing okay? I mean, we know it's just been incredibly overwhelming for going on 2 years now, and I mean, staffing could be short, right, in so-called normal times, but how are your colleagues and you holding up?
Uh, Thank you. Great question. I will say easily, we have multiple teams here at our clinic. We have a public health team, we have a medical team, a pediatric team, we have a pharmacy, dental, and all of us probably have been putting in 50, 60-hour weeks since the beginning of the pandemic. And so we are, uh, unfortunately, we have lost a few staff because of burnout. Um, and it comes in exactly like the waves. This for Lummi, this is our fifth wave, and we've been fortunate in these 5 waves. Lummi has only 5 deaths related to COVID. I know some other communities have struggled and had much higher counts, but it's been I think our work has shown that it does protect our community, and so we've here at Lummi we've been very fortunate in that the majority of our staff has stayed here, but it certainly is stretching us thin, and uh, not like the hospitals, which are struggling with nursing staff and other medical staff shortages. We don't. We have the benefit of not having to be open 24/7, only 8 to 5, Monday through Friday. But it turns out I end up working Saturday, Sunday most of the time, like today.
Well, thank
Not
you.
not this not this meeting. This morning I was doing a bunch of contact tracing calls.
Mm. And I heard on one of the Sunday talk shows today that contact tracing is almost. I mean, you're a smaller, more isolated community, but writ large, contact tracing is almost impossible to do, right? With how fast this variant is spreading.
Yes, that's exactly what I'm finding, and our public health team is finding. We, you know, we're the reason why we're able to do it is because it's a small community, but where we are struggling is that when we only have 6 staff members on a public health team, and which not only does contact tracing, they manage our treatments, they manage our testing, and so they have quite a load. And so the in many ways, the contact tracing is mostly just we only tell people if they're positive. If they're negative, we inform the community. We don't tell them. It's up to them to look it up online.
Let me ask you again, Dr. Lane. Um, you've got young children there, and obviously there's a lot of youngsters in Indian country. We're a very young community, and probably half or more, younger than 21, 25, and a lot of kids running around. What's your recommendation to families with a mix of kids with younger than 5 who aren't eligible for the vaccine, probably going to school, maybe full time, maybe part time, but they're going to school. What's your how does family stay safe? What do you tell people?
Great question. From a policy standpoint, our health team has always advocated keeping the schools open as much as possible. Right now, our local Lummi Nation school is closed because of staffing issues. Many of the teachers have been quarantined, and many of the bus drivers have been quarantined. We hope to get it open as soon as possible. It's really a matter. So I'm talking policy. Get down to the families in a second. So from a policy standpoint, I encourage all of those who are listening to strongly, strongly keep the schools open as long as possible. There is huge. We have a psychiatrist on our team, Dr. Bud Vanna, who reminded me a couple of weeks ago that the most important thing for the mental health of our children and even parents is to keep schools open. And so what I would recommend to tribes and tribal councils is that they should do everything they can to keep schools open, because the risk to kids, the long-term risk to kids of missing school or falling behind in school is very real. And the risk of COVID, while it's there, is not as elevated as it would be for, say, if we had elders going to school, which is an interesting concept. But the kids seem to recover a lot faster, and they do all right. Like, for example, here at Lummi, we had actually a couple outbreaks related to basketball. They got quarantined. We're recommending that they mask up. Many of the basketball players were vaccinated, and guess what? That was early 3 weeks ago, just before Christmas. We had a couple of basketball tournaments, and unfortunately, they got positive, and literally every single kid on that team recovered. And I'm not saying that the COVID risk I'm not trying to minimize it, but I think we also need to balance it with the risk of mental health risk and education risk of not having, those social events and educational events. I do encourage all of those to be vaccinated. That young daughter of mine who's 4, we have her wear a mask. I know many parents feel like their kids can't wear masks. I would argue otherwise. Kids are pretty good at following instructions, and you have to model the behavior that you want your kids to follow.
Hmm. Yeah, thank you for that. Thank you for that. Um, you noted that at least the tribes in Washington State where you are have fairly high vaccination rates, and we know that we emphasized vaccinating our elders very early on. Um, there are some folks who are sitting on the fence, of course, and maybe they're in more of those particular areas of that you mentioned that are maybe more conservative leaning places where they're hearing more of that from their neighbors and so forth. Um, is this a cut and dried argument that you make with folks who you come in contact to that have chosen not to be vaccinated, or I mean, is there uh, how do you try to have a conversation with folks who still think it's not for them, or they're just still waiting for something?
Can you guys hear me?
Yes.
Okay, sorry. Okay, so a couple things with regard to talking to people who are. I don't know this one. Sorry. Um, my daughter's behind. So with regard to talking to people who have chosen to not be vaccinated for a variety of reasons, generally I just the exact same risk I described earlier, that 90% of the people who die are unvaccinated.
Mm.
For the 10% of people who do die who are vaccinated, is because they usually have some medical complications from very uncontrolled diabetes, morbid obesity. So, if you weigh a lot of weight, I'll say 300 pounds, but it depends on your height and weight. But if you have morbid obesity, if you have some underlying cancer treatment, rheumatologic treatments that suppress your immune system, those are the ones who are most likely to die despite being vaccinated. And there's also now new evidence that the so-called long haul COVID, in other words, if you get COVID and you suffer from mental fatigue, in this case, some people do suffer from um, almost what we call arrhythmias, which is where your heart rate is irregular, has some weird beats, that can continue, and you just struggle to recover. And so there is evidence that the vaccines prevent that from happening. In fact, I knew that if I didn't get vaccinated, I'll be honest, the main reason why I got vaccinated was because I didn't want long haul COVID. I knew my risk of dying was quite small. And so, but I didn't want to deal with long haul COVID. I want for me, my biggest asset is my brain, which I spent, or at least the Indian Health Service invested a lot of funds in it to train me. So, I want to say like $250,000, to be honest, in my brain. So I don't want to lose my brain.
No, we don't want to lose you at all. And actually, you had a very interesting path, right? You were, as I read something about you, you started in engineering, and what was this turn to med school?
Yeah. So, yeah, thank you for that question. I, to be honest, I went into undergrad wanting to build and design video games. But when I got to undergrad, I just realized that's quite boring. You sit in front of a computer all day, and your eyes start to hurt from looking at computer screens.
Hmm.
So then I switched to electrical engineering and worked for AT&T Wireless and IBM. That was great. I loved it. I built some cool stuff. I worked with on the national network, data network. Believe it or not, I was on the team. I mean, I think you're of the generation, but maybe some of the younger ones don't realize this. But American Idol, when you could first vote by text, I was on that team that helped. I was a big side player. Whatever they told me to do, I just did. But the project manager on that was the one on AT&T Wireless who implemented that. But the vote by text with American Idol in 2002 was I got to witness that and be a part of that. So it was pretty cool stuff. But I was stuck in a cubicle. I mean, not a cube, a cubicle, and just wasn't for me. My grandparents, my late grandparents, Vernon and Nancy Lane from Lummi, had always told me I need to come back and serve Lummi. And I didn't know how I could do that. I loved electrical engineering, but I didn't know how I could do it. So then I switched to being a Peace Corps volunteer. I went and was a teacher in Malawi, Africa. I wanted to travel and did that, decided to become a doctor, and then came back to Lummi.
Wow, you're one of those geniuses that some of us we can only take so much of that. Just teasing you. Dr. Lane, before we say goodbye, anything else you'd like to add? We really appreciate your time tonight. Some very clear statements here. 90% of people who've died have been unvaccinated. I mean, what else do you really need to say? You're still muted, and we'll give you we'll give you your final word here, Dr. Lane, and let you get back to your family tonight.
Oh, that's very kind of you. To be honest, I would like everyone to understand that COVID, as frustrating as it is, as much as it has disrupted our lives, I think it's important people understand that when we implement public health measures, and I say we as in the federal government, tribal governments, state governments, we're actually responding not because we want to stop you from working or lower your, it's most, stop school or make you wear masks. It's mostly because we're living in COVID-19's world, and it sets the rules. And the likelihood of someone dying from COVID, although terrible, is still very real. It's still last I checked is less than 1%, at least locally here in Whatcom County. So the likelihood of you dying is 1%, right? Who is that? But what really matters is whether or not you're able to contain that, so that the people who are 1% is not your family. You don't want that to be your grandma. I mean, the story is still the same. You don't want grandma and grandpa to pass away. You don't want our elders who know our language and our culture and our teachings. We need them around. And when you quarantine, when you vaccinate, it's less about you and more about what are you doing to protect your community. I talk about this with many of my cousins. We jokingly say, and when we're elders and our grandkids ask us, what did you do during this pandemic? And if, at a minimum, you should be saying, I got vaccinated, I isolated, and I did everything I could to protect my community. I don't think you have much ground to stand on if you said, I stood up for my liberties, my individual rights. I'm not sure that really will hold sway 40 years from now, because at the end of the day, human beings are social human beings, and people care you care about your family, you care about your friends, you care about all of those whom you love. And if your answer is, I did everything I could to protect them, that's the best you can do. So, I know that individual thing is very much an American concept, not necessarily a tribal or Indian concept, but those ideas still percolate through from outside into our communities. And I just would encourage all of you to really consider that, because we want a healthy community.
Mm. Thank you so much, Dr. Dakotah Lane of the Lummi Nation. They're lucky to have you, and we're lucky that you were joining us tonight. And hope to have you on in a few months if you're up for it. And we really appreciate you running. Thank goodness you have that tech background. You could really troubleshoot your phone and your computer and whatever else you had to do to be with us tonight. So we appreciate it, and stay well, and hope to get some sleep tonight. And take care. Thank you. This is a conversation about we can do this, Indian country. We can do this. And that was Dr. Dakotah Lane of the Lummi Nation in upstate New York. And earlier, we heard from Dr. Luhui Whitehear from Central Oregon, whose people are from the Central California coast, I believe, Dr. Whitehear, at least ancestrally. Um, what did you think about what we heard there from Dr. Lane, Luhui?
Yeah, that sounds like a lot of what's going on down in this area too. I think that the COVID presence was definitely real, and one of the things I know that's a worry for folk is that people are going to say, "Oh, well, vaccinated people are getting COVID now too," and so thinking the vaccines don't work and forgetting that that's what's preventing a lot of those hospitalizations that Dr. Lane was talking about. And I really hope that folk heard what he said, because I know that's the struggle in some of the communities. I feel like there's still a lot of vaccine hesitancy in the communities around here, and even locally here in the city that I live in, knowing I serve on our local school board too, and so knowing we're doing a lot of vaccine education with communities that are underrepresented in the vaccination rates, so mostly Indigenous, Pacific Islander, Latinx families, doing outreach mostly with a lot of those folks. And the district is, I'm not saying I personally am, and but that's what we're seeing, is that there is still some hesitancy among certain populations, and even locally in smaller towns like the one I live in. It was kind of sad for me to see the percentage of the American Indian Alaska Native group being as low as it was, just knowing how this virus has impacted our communities. Um, and just feeling like a lot of us know at least several people that have had it and or that have it currently. So yeah, I'm just reflecting a lot on what Dr. Lane said, and it's just so real. And knowing the folk that I know that have passed were not vaccinated from that did pass from COVID specifically, in addition to those who have passed for other reasons during this pandemic. And yeah.
Let me stand by, Dr. Whitehear, and let me ask our producers at Native Roots Radio to play a audio radio spot that has been produced for the We Can Do This Indian Country campaign. It really sort of aligned with what Dr. Lane there said at the end in terms of Native people being more relational, right? And like all people, very social, right? We're about connection, and we're about family, and we're about togetherness, and all for one and one for all, right? And not this more individualistic lens that so runs the media, right? The news is constantly uh, putting those messages out there about, freedom this and liberty that, as opposed to this other story, right, which is a people story and a connectivity story, and really about caring for one another, and ultimately even about love. So here's another spot from We Can Do This Indian Country, a 30-second radio spot.
From day one, we welcome our children into the home. When they feel the want and the love, they grow very strong. No matter what tribe you're from or where you live, we all know how important our children are to our cultures. Protecting them from severe illness, hospitalization, and even death from COVID means getting them vaccinated. Everyone 5 and older is eligible for a COVID vaccine.
We can do this. Go to vaccines.gov to find vaccines near you. Paid for by the U.S. Department of Health and Human Services.
And vaccines.gov is a good source of just a quick chart, right, that can tell you your age range of you or your child or your adolescent, the 3 types of vaccines, and whether they've been approved or authorized for those age groups. And as we speak, primarily the Pfizer vaccine has been approved, or received emergency authorization, I should say, for children ages 5 and older. And the Moderna and Johnson & Johnson vaccines haven't yet received that status. So Pfizer right now, 5 and older, and boosters recommended for everyone, adults, all adults, and the Pfizer booster for adolescents. Luhui, what you talked about the school system that you're in. How are you balancing that there? The safety issues. I know some teachers have felt, right, that they're being unfairly at times being asked to kind of bear the burden, right, of a lot of this, with perhaps not all of the supports that they feel that they need. And yet Dr. Lane talking about mental health and isolation and issues with children not being able to go and be part of something. How are you balancing that there in your backyard?
Yeah, that's hard, but I think that what we've seen here in the local community is kids really want to be in school, and like Dr. Lane said, they're really good at following directions and following by example. So if they see the adults in their lives wearing masks and talking in a positive way about vaccines, they're more likely to want to do that as well. The local school district here is in full compliance with all the mask mandates, and our county has the highest rate in the state of Oregon for vaccinations for that 5 to 11 range group. And so that has to do a lot with those vaccine outreach kind of efforts that I was talking about earlier. And so knowing that here locally gives me a lot of hope. And I think it shows a lot of a good example of being in good relations with each other and working in community. And not everybody here, there's not a lot of Indigenous folk that live in Corvallis. It's definitely a predominantly white community, but that doesn't mean that people don't know how to live in good relations with each other. And I think that that's what this is showing. And there are folks, of course, that don't believe in vaccines or don't believe in that COVID's even real still, even I think in all communities, but I don't think that's the majority here. And I see that on campus too, where I work, where students are, I think there was a lot of like, are students going to really wear their mask to class in the fall? And they did. They were like, it's like a small price to pay to be in person, because I think even at the collegiate level, even if it's students in K-12 are in college, people really need that connection with each other, and that opportunity to learn and thrive and build community with each other in different stages of their education. And if that means wearing a mask so we can get through this together, I've seen a lot of positivity around that. people, of course, are tired of it, but but they're still doing it, and just normalizing conversations about vaccines and also testing. Right now, I know that's something on campus that I'm trying to really do is like normalize that conversation and make people feel like they shouldn't be scared if they need to go get tested, or feel embarrassed or ashamed if they were potentially exposed, because that the variant right now is like just wildfire in all our communities. And being able to say like that reminder of like, we know this has probably impacted you personally, with family and your communities wherever you're coming from, and saying, just let me know the support you need to go get tested, and make it where it's not this shameful thing, or even normalizing asking for time off, because I think in this society we live in, a lot of times it's like you still have to go to work, and I think that they're in that privileged moment right now because some places don't have time off available to folk, and they are making some tough choices of hiding illness sometime. And so I think just the age demographic I'm working with, they're able to take that time to test and also to get well. Um, and then back to the K-12, um, we've also had some um, adjustments to our school calendars that we approved after the teachers union and superintendent and staff talked about extending some days off for the teachers and staff, for their own well-being, so they can be present, because it's that strain that you're talking about. Like, it's all on them. They're expected to do all the things that society requires and the way that it functions. Schools have to be open, and they know that. And it's on top of they care about kids and want to help educate them. And so being able to help do that supportive measure as a school board member was really important to me, because I know how hard they work, and I think the other board members as well is like really supportive of that extra time off or the 2-hour delays once a month as well, to have that prep time, instead of saying like, not only are you stressed out all day, but you also have to do your prep stuff at night after all day. And so that was a long answer.
No. So your school district, how has it worked? You're giving, what have you cut back on in school days? What, one day a month, or how's it work to give
So
teachers that extra day off? Or
yeah, so they looked at the calendar, and it was done in a way where it is like, do they need these training days, and like talking with their union. It was a lot of negotiating, being able to spread some time off. And I know that that's a tactic that's being used by some teachers unions in requesting time off. That way, the students are still meeting the requirements of the in-person learning, because there's so many hours by law that they have to be in school a year. And so making sure that that isn't taken away. And there's also other potential ways to help with that. With it's not snowing as much, are we going to need to take off a bunch of snow days and stuff like that, where things are kind of built in. And so that's been really helpful. And I think it's really boosted the morale of teachers, which then has that ripple effect with students too.
yeah, that's good to hear that you're able at least to talk to them too, and have conversations, because it's right. It's all about listening and trying to reach some sort of shared understanding, and that it is about kids. And I know we often say, "Oh, it's about the kids," but boy, uh, I, my kids are out of K-12 now, and I'm just so grateful, because I don't know what it would have been like to, help guide them through, X number of online classes, and um, not be with their friends, et cetera, et cetera. I my younger one was a soccer player, and I went back to her high school team uh, this past fall for their fall season, and I helped them with a video because they had missed out on so much in 2020. And the thing they missed most, these players said, wasn't the games. They played quite a few games despite the pandemic, but it was all the social stuff that they did together, right? The sleepovers and the pizza parties and stuff that they were forbidden from doing, and that's what they missed, right? These are kids, and
Mhm.
So congratulations for trying to figure that out. And I hadn't heard of that kind of creative scheduling too. So that's good to hear that even if they're baby steps sometimes, right, that you can kind of go toward meeting people where they want to be met, and working on this like the campaign says, we can do this. Luhui, let me ask you to hold on one more time, and let's play one more clip from this campaign, We Can Do This Indian Country. We just heard the Children Are Sacred video, and I think, no, we didn't. That's the one I wanted to play. This is another clip, radio clip from the We Can Do This Indian Country campaign. Let's listen.
Children are sacred to us from the moment we welcome them into the home. When they are happy and feel wanted, they grow to be very strong. No matter what tribe you're from or where you live, we all know how important our children are to our cultures. Protecting them from severe illness, hospitalization, and even death from COVID means getting them vaccinated. Everyone 5 and older is eligible for a COVID vaccine.
We can do this. Go to vaccines.gov to find vaccines near you. Paid for by the U.S. Department of Health and Human Services.
Part of the We Can Do This campaign of the U.S. Department of Health and Human Services. More information at wecandothis.hhs.gov and at vaccines.gov. Dr. Luhui Whitehear is joining us tonight from Corvallis, Oregon. She works at the campus of Oregon State University with Native American students, and also is involved in the community with her school district and her family. And you probably don't get 8 hours of sleep every night, do you, Dr. Whitehear?
You're right, I don't. That's true.
How do you help your kids? I've been visiting my sister, and she's got a sophomore in high school, and he doesn't want to wear a mask, and he's kind of tired of all of it. And how do you keep your kids vigilant of, let's just keep at it. Let's keep at it. What are your mom tips?
Oh gosh. Let's see. They're actually pretty good. Even my youngest. So the kid range is 9 to 18 here. So they're all pretty good and about wearing their mask, and like, oh no, I forgot it in the car, and running back and getting it and that kind of stuff. I think sometimes they just get spacey. I've done that too, where I've walked in a store and I was like, oh no, ran to the front desk or register. And I was like, do you have a mask? Or I'll go back to the car if I'm not in yet. But I think sometimes it's easy to forget because you get in a zone, but they're really used to it. And like I said earlier, I think that it's just modeling the behavior too, and talking about the benefits and thinking about the bigger picture. And they love their family and their grandparents. And I think being from like an Indigenous community, that knowing that value of taking care of each other is just so ingrained in them that they don't really think twice about it, because they know it's not just about them. And so like even with the boosters, like asking if they're eligible yet, because the rollout of the vaccine schedules means that there's delays in getting them and stuff like that. So I didn't really ask the bigger ones about that. They kind of asked like when they were eligible to, or we just had conversations about when I was getting mine and stuff like that. And so I think that just normalizing the conversation, like I said earlier, not making it sound like it's something bad or like a drag, and just like, okay, mom may not be feeling good. Here's what you should make for dinner if I'm not, with the side effects from the booster, which actually wasn't that bad. But so I think that just that normalized conversation is helpful, and just because of their upbringing, know that it's about the community, and it's about like in trying to make sure as many of us are here the next time we gather too for our community gatherings and ceremonies, because those aren't happening here in this area right now. Still, I know they are in some tribal communities, but they haven't here locally.
I really liked what you said earlier too, that wearing a mask is a small price to pay to have these in-person activities, and yet you go into so many public spaces, and there's a lot of people not wearing that mask, and when your kids see that kind of thing, you've probably been through it a number of times now, so you don't even go there. But they also must question at times. Do we have to wear ours here? Can we just take them off, Mom? Right?
Actually, my youngest, the one that's 9, has asked somebody why they didn't have a mask on before. They're actually they're pretty good about their masks. They do not want COVID. Some of our family has got COVID too, and have long-term effects of it or not had long-term effects of it, and they're like, they do not want it. They don't want me to get it. They don't want to give it to somebody else, and so they're really, whatever they can do, they're trying to do too, and also like asking for hand sanitizer and stuff like that if we've been out at the store and things like that. It's just part of our routine at this point. And I think just that overall healthy behavior and modeling it and just making it part of our everyday has helped with that.
At the University of Oregon State where you work, I mean, have they adapted the coming spring schedule at all, or any pushed things back or gone hybrid at times? Is any changes to the routine there because of the Omicron variant?
It's a hard one because I kind of wish we did. We're on quarter system, so we just got done with week 1, and it was rough. It was a really rough week 1, and a lot of students having to test and being really stressed out and like making that decision of whether or not we should have the center fully open like the rest of campus and stuff like that. And so it was really hard, but they went 100%. And they also rolled out the deadline for the booster. They require the booster of all faculty, staff, and students. And it's a high vaccination rate. It's like the high 90s for staff and students. And so it's the mid to high 90s, I should say. And so the rate is really high on campus, but people are, of course, getting it because of the variant, if they haven't got their booster, especially. And so they require the booster as well. And there's a mask mandate still in Oregon for indoor spaces. And so I think all of those things are helping, but people are still getting sick, of course. And so it's stressing everybody out. And plus they're like traveled and didn't know if they caught something while they were traveling. So I wish we would have went a little bit remote. So
Sure. Well, it's interesting, and this is just when you said the beginning of a new quarter, right? I remember talking to somebody at a different large university that was in epidemiology, and her specialty was actually testing the wastewater, right, of what's happening in the bathrooms for signs of activity that whatever we ingest is going to show up in the wastewater. And so she was and her colleagues were testing the wastewater at this large university, and one of the things that they were checking out was the stress hormones, right, that students were dealing with. And what was interesting when she was telling me about this was it wasn't during finals week, when you might expect people being very stressed out. The stressful time was at the beginning of the term, when things were unknown and they didn't know, what the expectations for classes were going to be. They didn't know maybe their professor or their instructors, just the unknown was stressful. So it sounds like that's what's happening there.
Yeah.
And it's not easy in good times.
Yeah, that's definitely true. And a lot of people in my class, like, I don't know if I should come to class. I'm scared. And I'm like, it's okay. Don't come then. I'm not going to mark you absent or take away points, and just take care of your mental health right now. It's a rough time for everybody. And I think the more people that can show that compassion and care for each other is just going to help keep us strong, instead of looking at it like, well, you have to do this. So the best we can. I mean, there's a lot of things where that's not possible, but in those moments where we can show that little bit of compassion and that support, I think it's really important.
Dr. Whitehear, thank you for that. Hold on one more moment here, Dr. Whitehear, and we'll come back and give you your final word. But I wanted to play another example, and we started the show with this, the start of the discussion tonight, with the video clip from the We Can Do This Indian Country campaign. This clip produced by G&G Advertising, a Native American subcontractor on this campaign. Let's watch this 30-second clip as we bring this discussion toward a close.
Do you know I love you so, and mommy will never let you go. To the stars and the sky, you'll always be mommy's little guy. Hey, oh, hey, oh, hey, oh.
Dr. Whitehear, I know you know some of the staff at G&G, and I think next time we might have to ask you and your kids to be part of the next one. What do you think?
Some of them might do it. They might get shy, but they might, yeah.
Any closing comments that you have as we say goodnight? We really appreciate your time tonight on this late Sunday for you.
Yeah, I would say that just to, like, the whole thing says we can do this, we can, and I think it's important to remember we'll get through this. This isn't it's not the never ending. It is going to take time, of course, but the more we work together and pull together and help us get there, the stronger we'll be. I know that our communities have been through a lot historically, and this is one of those moments where we're going to have to show up for each other and just remind each other, like, that like I said earlier with my kids, it's about more than just us as individuals. It's about our communities and our strengths, and making sure we're still here so we can keep passing on our songs and dances and ceremonies and the ways we gather and all those things that make us who we are. If we're not here to pass those on, then they're going to be gone too. And so I would just say, stay strong, y'all.
Awesome. I should have asked you this earlier. What do you like to teach there at the university when you are in the classroom?
Oh, I like teaching on the Indigenous class-based classes. Right now I'm teaching a Native American law class, not for lawyers. I will say it's an ethnic studies class, so it's understanding the impacts of treaties and policies and stuff like that. That's one of my favorite classes I teach. And another one that's called Arts and Social Justice. I like all the classes I teach, but those two I'm excited about this year.
Nice. Well, we really, really appreciate your insights and your perspectives from the many hats that you wear there at home and at school and the university too. So thanks so much for joining us, and I feel confident we're going to see you again down the road, because you're just you're like just calm, right? Your kids
I've
probably
heard that
say, well,
before.
you should see her, you should see her then, right? Well, stay well, be safe, and take care.
Thanks, you as well.
This has been another discussion. We can do this, Indian Country. We can do this together, and you've heard the creative spots produced for the campaign tonight, aimed at Native American folks. Now that the Pfizer vaccine has been made authorized for children ages 5 and older, all adults are recommended to get the booster. Adolescents are eligible for the Pfizer vaccine booster. So if you are an adult older than 18, the booster is any of them, right? I received the Moderna, and the booster can be any of the shots. So even though my first 2 shots were Moderna, the booster could be whatever's available. It doesn't have to be the Moderna again. So if you're an adult, go get your booster. If you're 5 and older, go get the Pfizer vaccine, and keep watching the headlines to see when those vaccines might be available for younger children. But this has been a good conversation with Dr. Dakotah Lane of the Lummi Nation and Dr. Luhui Whitehear from Oregon State University. I'm David Kenoyer. For more information, wecandothis.hhs.gov and vaccines.gov. Take care. Thank you for tuning in, and we will see you next time. Meanwhile, we can do this, Indian country. Take
Think of our loved ones.